Hello, my name is Ethan Schmidt, and today our group will be speaking about prescription pain medicines with athletes. Athletes are our audience because they're at a higher risk to be possibly addicted to these medicines. And this is because after major injuries that required medical attention, such as surgery or resetting bones, they're usually prescribed some form of painkiller. Many athletes have become addicted to opioids. The biggest name is probably Tiger Woods. A few years ago, after he had his whole back refused together, he had been prescribed a bunch of opioids, and he was driving one day and got arrested. And that's a picture of his mugshot right there. Some background information. According to the CDC, prescription opioids can be used to treat moderate to severe pain and are often prescribed following surgery or injury or for health conditions such as cancer. These opioids are highly addictive, and is because of their strong effects they have on pain medicine or pain recipients. It basically takes away all their pain and they feel euphoric. Some common prescriptions include hydrocodone, oxycodone, codeine, and methadone. These pills are often not refilled multiple times. So when this is the case and patients start to get addicted, they will go to the streets to find these drugs. And a lot of these drugs are not fully safe for use. A lot of them have fentanyl in them.
So my name's Hayden. Just a little bit of background information is that in the 1990s, pharmaceutical companies really started advertising opioids to prescribers, saying that it's less addictive. Then this led to higher rates of addiction during this time and has led to other waves of addiction with increase in heroin in 2010 and then fentanyl in 2013, where even higher rates of overdose deaths have occurred due to the powerful effects of fentanyl. Some other commonly prescribed opioids that are kind of gateway opioids, for example, is Percocet. Percocet has become really prevalent in pop culture with like different musicians referencing them as perks, and like 21 Savage, Migos, and Future, each referencing in their music. And then also lack of patient education, where patients aren't fully educated about when to stop taking opioids and when to continue, which can lead to higher rates of addiction within the patients.
So my name is Tom, and I'm going to be looking over some of the gateways to opioid addiction, and some of these include the abuse of prescribed opioids. So that can be either taking them longer than you're supposed to or changing the administration route. Some other drugs have been correlated with it, like marijuana, but it's more so the behaviors associated with these drugs that lead into this correlation. It's not necessarily the drugs themselves, like these risk-taking behaviors will also correlate with an opioid addiction. And some potential risk factors associated are unemployment, family history of substance abuse, risk-taking behavior, depression, anxiety, high stress, and some of these other things that we see in this graphic on the left. And so when we're looking at treatments of opioid addiction, the highest success is seen with counseling, that positive supportive environment. And alongside that counseling, drugs can be used to help alleviate some withdrawal symptoms and cravings to help that person along. Methadone and buprenorphine both bond to that same receptor, and they help alleviate these withdrawals by giving some pleasure and reducing cravings. Naltrexone binds to the receptor, doesn't provide pleasure, but helps to also reduce these cravings. In an extreme case of an overdose, naloxone binds to the receptor and flushes out all of the opioid to end that overdose. And on the right here, we have the typical timeline of withdrawal symptoms.
My name is Harry Patel, and I'll be going over the statistics, over the main points. There have been over 48,000 overdose deaths in the US in 2020 involving an opioid. Pharmacies fill out 153 million opioid prescriptions every year. Opioid overdose deaths have increased by over 519% from 1999 to 2019. Athletes have a 50% higher risk of opioid addiction when comparing to the normal population. In particular, male athletes have been found to be twice as likely to be prescribed painkillers and 4 times as likely to misuse or abuse their prescription. In the state of Georgia, there have been over 860 people dying from overdose in 2019, and over 50% of those deaths have involved prescription opioids.
And here's just our references.
Okay, so your surgery was successful. I'm going to prescribe you 1 week's worth of oxycodone, and you'll come back and check in with me next week. We'll see how your knee's doing.
Thanks so much, Doc. Hey, Doc, my knee's still in a lot of pain. Do you think I could get another week of oxy?
I mean, your knee's looking good, but if you're still in a lot of pain, we can give you 1 more week.
Thanks so much, Doc. I would really appreciate it. Oh, my leg really hurts. I think I need more.
Didn't you just take one an hour ago?
It's fine. The doc gave me a prescription for a week. He'll give it to me again.
Yeah, if you say so.
Hey, so what are you doing back so soon?
I'm still in a lot of pain, Doc, and I ran through those meds already. Is there anything you can do for me?
I mean, the swelling's gone down and the healing is going really well. I don't think I can refill your prescription. We don't want you to become reliant on these.
Oh, come on, Doc. You sure?
There's nothing I can do for you.
Hey, man, I'm not feeling too good. I think I've got the flu or something. I've got like a fever and headaches. I got chills and sweats and all this stuff. You think you could give me any more oxy?
I don't know if that's a good idea, man. You look like you have a problem.
No, I think I'm just going through withdrawal, man. I think I just need a little bit more. I can take myself off.
Okay, I mean, if you feel like that, yeah, I know a guy that can help you.
Thank you. Please.
Yeah, I got you. Hey, man, you okay?
Doing too good. I ran through all that oxy. I'm all out. Like, you think you can give me any more?
Look, man, I can't give you any more. I think you have a problem.
No, man. Like, I'm fine. Like, I'll be all right. Like, I'm gonna get off it. I promise.
Look, okay, I don't want to go to your parents, but you need help. So I need you to go to rehab with me. I'll check you in.
I guess you're right. I think I have a problem. Help me out.
Of course.